Massachusetts is increasing restrictions in most public places starting the day after Christmas. It's an attempt to curtail another surge in COVID cases. And here to discuss that is Dr. Helen Boucher, Chief of the Division of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Good to see you.
Great to see you, Emily.
All right, restaurants, businesses, they go to a max capacity of 25%. That starts Saturday. Hospitals have been directed to stop elective procedures. My question is about the timing of this. It's after a lot of people will have gathered for the holidays. So how do these measures reduce a surge?
Well, we really hope, Emily, that people will make the decision to give each other the gift of a small holiday gathering and to stick with just the family they live with to celebrate the holidays this year. And these measures are aimed to further give motivation and ways to keep gatherings small and to avoid crowding and to stop the spread. We are in a surge and we need to really double down on our efforts so that our healthcare system and hospitals can take care of the patients who need us.
So talking about the hospital capacity, we've been talking a lot about it lately. Fewer people are hospitalized with COVID right now than in the spring, but there are fewer hospital beds available. So why is that, number one? And why should we care about hospital capacity?
Well, two important questions. So the reason that we are full is because we have a lot of patients with diseases other than COVID who need our care, people with heart disease, strokes, cancer, other things. So we need to be able to take care of all the patients who need us, those with COVID and those with other life-threatening problems. And when our hospitals get overwhelmed, we know that the outcomes are worse for everybody, including the patients with COVID. So we want to be able to give everybody the best care, the care that they deserve. So working hard to double down on wearing a mask, watching your distance, washing your hands, keeping gatherings small, and staying home when we're sick will make that difference and enable us to take care of the patients who need us.
You mentioned a moment ago that we are in this surge. The U.S. hitting 18 million cases yesterday. It took less than a week to hit each of the last 4 milestones of another million cases. So in your view, can a vaccine still be effective considering the rate of the rollout, but also the rate of infection?
Well, these numbers are staggering and very hard to get our head around, but very concerning. And of course, it's possible for a vaccine to help, and we're grateful and hopeful that the vaccine is here. But until that time that we have 70 or 80% of our population vaccinated, we have to do the hard work of doubling down on the things that we know work. That is wearing a mask, watching our distance at least 6 feet, avoiding crowds, staying home when we're sick, and washing our hands frequently. This is what we know will make the difference. It's very hard. It's very hard to offer up this holiday season, but if we do, we'll all be together next year to celebrate and life will get back to normal.
Such an important point. I want to ask you one more thing about this that caught our eye. Doctors across the country are reporting seeing patients who are otherwise healthy, they suffer a stroke, then they test positive for COVID-19. Do we know at this point if there's any link between the two? Do we know if COVID could increase the chance of having a stroke?
Well, this is very interesting, and a couple of groups have made this observation of seeing more strokes than we would expect among people with COVID. And there are two sort of hypotheses that have been advanced. One is about inflammation. We know that COVID causes inflammation, and we see all these blood clots, and a blood clot in the brain can cause a stroke. So that's one idea. The other is that the process of atherosclerosis, or the vascular disease that happens to some people, can upregulate the ACE receptor, and that's the one to which the SARS-CoV-2 virus binds. So two hypotheses that are being investigated, and I think a reminder of how much we still don't know about this very new disease and need to learn.
Yeah, you and I have talked about that a lot over this year. All right, Dr. Boucher, thank you so much for your time. We appreciate it. Happy holidays to you.